A popular procedure to get rid of face wrinkles is gaining popularity as a way to treat migraines, Botox injections. Dr. Fredric Stern is here from the Stern Center for Aesthetic Surgery, as well as Lorraine Koski, who's gone through this procedure. Lorraine, let's start with you. You were having some trouble with wrinkles, first of all, right? And that's how you found out about this.
Yes, I originally saw Dr. Stern for Botox to treat wrinkles, forehead wrinkles. And then I discovered that my migraines disappeared.
How long after you started this treatment were your migraines disappearing?
Probably within 5 to 7 days.
And you probably weren't thinking it's because of the Botox, right?
No, originally I didn't know it was because of that. It wasn't until I mentioned it to Dr. Stern.
I'm guessing that you mentioned, you mentioned it to Dr. Stern, and then what did you do?
Well, I started hearing that a lot from my patients over the last few years, that people would tell me they knew it was time to come in for another wrinkle treatment because their migraines were coming back or their headaches would start coming back, and that was what tipped them off. And then about 6 months ago, a study came out exactly on that, that showed about a 60 to 70% decrease in migraines in people who were treated with Botox.
Now, as we look at the video of the procedure itself, Botox is what? A neurotoxin that paralyzes the muscles when injected? Is that what? And how does that affect migraines?
Well, no one knows exactly, but it seems as though people who have migraines frequently have a muscular contraction component, muscle spasming in anywhere in the forehead, the back of the neck, temple areas, between the brow. And in those cases, the Botox will relax those muscles enough it'll break that spasming, which often in many cases will precipitate migraines.
And from what I understand, Botox has been used to treat other facial conditions like cross-eyed
That was the first medical use about 20 years ago, and it's still used in children to treat cross-eye conditions.
And now that wasn't Lorraine getting the Botox injections in the video?
No, that was
okay, all right. Now you've seen what, 75 to 100% reduction?
I would say, and this is pretty unusual as medical treatments go, the study showed about a 70% reduction. I thus far have not had one patient that hasn't at least had some relief in their migraines or chronic tension headaches.
Lorraine included. How did it change your life? Is it completely gone?
It changed my life dramatically. It's not completely gone. I got a migraine at about 5 months after my injection. The injection was wearing off. And that told me, okay, I need to go get another injection. So when I got another one, it was time to get, another injection.
And Dr. Stern, what about the wrinkle factor? Because she originally came to you for the wrinkles. And clearly your face looks beautiful right now.
She doesn't have a wrinkle on her forehead.
No. And so this, I guess, is then now becomes a side effect of the migraine treatment. Then
exactly.
Is
that it smooths out the wrinkles on the face. That's right.
And you're okay with continuing to go get these?
Oh yes. I'm very grateful to Dr. Stern. I have my life back. Okay. It's changed my life dramatically.
Dr. Stern, how much does it cost?
It costs approximately $350, but it depends on what part of the face or head is being injected. In some cases it might be a little less, in some cases it might be more for people who have other parts of the face or neck that need injection.
Lasts about 5 months?
Lasts about 4 to 6 months.
Okay.
Right.
And in some cases, your insurance covers this, and that's the only one that you know of that covers it.
So far, that's right.
So far, it's Cigna and not any others so far as you know.
Correct.
Okay.
But I think we'll see that more and more happening.
Because of the migraine treatment.
Right.
Okay. Dr. Stern and Lorraine Koski, thank you very much for being with us here on Mornings Live on Q. By the way,